Good morning, ladies and gentlemen. The title of my presentation is Assessment of Correlation between the Characteristics of COS and Function of Parasite. I'm Dr. Yu, come from China, Japan, French Hospital, and I work in the Department of Interventional Medicine. The contents include introduction, material and methods, results, discussion, and prospect. The first is introduction. This application of COS. COS has been widely used to detect tumors and evaluate their nature and blood supply. The function of organs and tumors are correlated with their blood supply. So, COS may potentially be useful in the functional evaluation of hyperproliferative nodules. For example, in this map, we can see this is the normal function of renal, and this is disease renal. In the COS in artery phase, we can see that there is obviously enhancement in the cortical, and in the COS, the enhancement of disease renal has a lower enhancement than that of the normal function renal. But there is no obviously difference in the normal renal and disease renal in later phase. The TIC are most commonly used for quantitative analysis in COS, but the TIC depends on the ROI, which can only reflect limited characteristics. For example, this is the TIC, and the ROI is very small, but this lever is very large. The ROI only reflects this limited area of characteristic of COS. So, new method of interpreting COS match is needed. The brightness could reflect the concentration of contrast agents, and the total brightness could represent both the size and the nodule and the concentration of contrast agent. For example, this is a very large nodule, and the total brightness in this area of nodule represent both the size of nodule and the concentration of contrast agents. The part 2 is material and methods. The data of clinical COS and the value of IPTH from 65 SHPT patients who underwent microablation between September 2015 and August 2018 were retrospectively reviewed. The inclusive criteria include only one SHPT nodule will be displayed by both on ultrasound and MIB scan, and the same probe and the protocol, as well as the default parameters, have to be used to perform COS, and the value of IPTH returned to normal range within 6 months after ablation. And the Logic E9 ultrasound scanner with a 9.0 million Hz probe were used. The gain of the ultrasound scanner were reduced until the target lesion just became pure black, and 0.02 milliliter per kilogram of contrast agent was bolus injected into the left elbow vein. And then after COS, the TIC was established by the supporting software provided by GE company. And the parameters include the peak intensity PI, time to peak TTP, and the base to peak ascending slope BPAS. And then the data of DCAM was downloaded, and still the image was saved at TTP. And then the nodule was cut out from the background with Photoshop. For example, this is the SCP nodule, and this is the CUS map in the PI. So this area of nodule was cut out from this area, and the brightness value of pixels were calculated with meta left. For example, in this area, because there is no enhancement, so there is no data, and in this area there is a different enhancement, then it be calculated. For example, this area is 1, 5, 15, 1, 1, 0, 1. So the brightness of all of nodule was calculated. The part 3 is results, and there are total 16 cases enrolled in this present study, which include 8 males and 8 females. The mean age is about 54 years old, and the mean value of IPTH is about 1,133 peak every milliliters. And the mean maximum diameter of nodule is about 1.8 centimeter. And this is process of the CUS. We can see there is obviously hyper enhancement within the nodule compared with the thread tissue in after phase as well as the late phase. After the CUS, the TIC was established. Because we can see, because this nodule is obviously hyper enhancement in after phase, so the PI is obviously higher than that of thread tissue. And this nodule have low hyper enhancement in after phase, so the PI is obviously lower than that in thread tissue. And according to the results of statistics, there are correlation between the total brightness count and the value of IPTH, and the BPAS and the value of IPTH, as well as the TTP and the value of IPTH. In other words, the total brightness count and the PPAS as well as the TTP could be used to evaluate the function of SNPT nodule. And this is BPAS and V as the value of IPTH. This is TTP V as the IPTH. This is the value of IPTH and total brightness count. Then the part 4, the discussion as prospect. CUS is a promising method in function analysis of organs. According to results of previous research, the CUS could be used to evaluate the function of liver, and renal, and salivary glands. In current study, the CUS have a correlation between the function of peroxide. In other words, the CUS could be used to evaluate the function of peroxide. The CUS and the routine ultrasound have a multiple advantage compared with the CT, MRI, and MIBI. For example, the routine ultrasound have a high spatial resolution, and the CUS have a high temporal resolution, and the TIC have a higher quality and more precise peak point than MRI imaging. All of the advantage could be used to make a promising result to evaluate the function of the SLP nodule. According to the result of the present study, there are correlation between the CUS parameters and function. The BPAS could reflect the flow speed and concentration of control agent, and TDP could reflect the flow speed of control agent, and the PI reflects the concentration of control agent, and total brightness can reflect the nodule size, concentration, and distribution of control agents. Because all of these parameters could represent the characteristics of blood vessel on control agent, so they could be used to reflect the function of SHP nodule. And in last case, microablation would be used as an effective method for hyperparathyroidism. The most effective way, this is the most effective way for operation of partly inhibition of hyperparathyroid blood cells. So the microablation could reduce the value of IPTH and improve calcium and phosphorus metabolism. It can alleviate the clinical symptoms. In other words, in fact, in many patients have the disappear of the symptoms after microablation. It could improve quality of life and prolong survival. And in this process, the CUS could contribute to an individual ablation plan. CUS could predict the secreting function of each nodule. For older and weaker patients, ablation of certain nodules instead of entirety of the parathyroid gland may prevent serum hypocalcemia. Because generally we always ablation all of the SHP nodule, but for the old and weaker patient, if we ablation all of the nodule, the value of IPTH will obviously decrease, which may be induced serum hypocalcemia. The serum hypocalcemia is dangerous for those weaker and older patients. So, CUS before operation who selected hyperparathyroidism nodule with high function as the main target for ablation. In other words, we can use CUS select some high function SHP nodule and ablation ablation them, and left a small nodule with a minimally function to avoid the serum hypocalcemia to prevent the complications. So this is my presentation. Thank you for listening.